What's going on, YouTube? So the books are below, guys. I put links down there for you guys to do, um, for you guys to look at. I haven't even set the phones up. That's how quick I just came over here and kind of sat down. So we're finishing Integumentary, right? We finishing Integumentary. You guys got any questions? You guys go ahead and DM me. So in your CPC guide, right? I'm on page 87 in CPC guide. I've got to put that other one in there. I got to order it today. So in your CPC guide, there's going to be cases in the back of Integumentary system. You guys already read what you were supposed to read. You should be ready to do that. I'm just going to pull up my step-by-step just to kind of keep us on the same guideline. So we're really done, with the step-by-step. You guys have done everything you were supposed to do in that. Okay. So at this point, you should have your CPC guide and your step-by-step. Okay. Let me get this. Okay. In your CPC guide, that's where you're going to do your cases at. Let me turn this down and cases up. Okay. Those of you who resume, what are you talking about? Why would I want to resume that? Those of you who don't have that book, just look at the bottom and you can go ahead and get one of them links down there, and it should bring you to where you need to be. I'm just kind of pulling up my step-by-step book, and of course I always got to sign in. So if you guys, I don't know if you guys actually have your book or you're using the ebooks down there, that's fine. Generally, you guys know I'm usually on in the morning. But I kind of switched up times around so I could do Sapphire Academy a little later. So I've already finished with that. We just kind of started. No, I don't have my regular glasses on. The other ones are right there, but I thought I'd swing these today. I lost the other one, so y'all got to bear with me. But so I don't know why this is here. Let's get rid of that. Some of you who may not have your book, the links are down there, so you guys can go ahead and get that book. Okay. And it's 35% in there. All right. If you guys want more, you guys can, click on that and purchase the book, if you want to. But for this class, there are several books that you do need. Okay. And again, the step-by-step is one of them. Okay. That's your go-to. Okay. Your other book is the step-by-step workbook. Okay. Then you're going to need your CPC guide. Now, throughout this coding course, let me get in here and wait for that to load. Throughout this coding course, you guys should have all of your books. Okay. We've done the work in the step-by-step. So, an integumentary system in the CPC, you want to go through the introduction. Okay. Go through your introduction. I turned the air off. I know I'm about to burn up. You know that. Go through the introduction. Okay. We are on integumentary system. So my book is getting ready to load right now. I did bring the hard copy books because we are going to be working on hard copy books. Okay. Those of you who have not been able to get that book, all right, go to Amazon. Okay. I think that the 2026 was on sale. I think it was 120. The 25 was like 69, and look at this all over me. And I think the ICD-10-26 was like $70. It still should be on sale. Okay, so I'm waiting for my book to load up. You guys should have your book up there already. Okay, so again, we're in integumentary system and we are in the CPC guide. Okay, in the CPC guide, you're going to do the same thing. You're going to do the reading. Okay, you do have a glossary back here. That's going to be in every chapter of the CPC. Okay, your CPC guide is your go-to. Okay, that's what we use in this classroom when you get to your advanced classes. In your Elsevier step-by-step book, let's get out of that. I don't know what's going on with that. In that Elsevier book, We literally already done everything that you need to do. Okay, some of you who have missed those classes, don't worry about it. You can always archive, and when you archive, you can slow it down. You can turn it on as much as you want to, and you can backtrack. When you are doing your archive, you guys can DM me while you're doing that. Okay, so I try to make all kind of ways for you guys to get through. Okay, I don't know where it is. I haven't turned it on. I can't find my iPad. I can't find nothing. I need a bigger desk. Um, so if you do not have your CPC guide, I'm going to see if they have the CPC guide in um, e-form. I don't think so. I'm not sure, but I'm gonna go find out. I gotta figure out a way to get you guys that book on a temporary basis as well. I don't know if it's doable, but I definitely can find out. The CPC guide is your go-to. That's where you're going to take. That's how you're going to take your test. You're going to retain what you read into this book. Okay. When we were talking about last week, the skin, the epidermis, and the dermis, subcutaneous. Those are the things that you need to retain for your test. Okay. The first thing that we do in your coding sessions, it's kind of repetitious. We do the step-by-step book. Okay, and then you're going to head for your integumentary system. Same thing, show you how to do the coding, and then you head for the books. In this section, you are going to continue to read your ICD-10, okay, and neoplasm. The first thing that you see when you get in your CPC book is pretty much your introduction. The same thing that we see in most of all the chapters, right? There are anatomy and medical terminology in here. So the first thing that I see in this book, you have to retain. Okay, so let me break for a minute. I don't know what happened last time, but I think we got to about 45 minutes and StreamYard cut off. If StreamYard cuts off after 45 minutes and I'm still teaching, I'm going to jump on OBS and you're going to see a part 2. Okay, so back to CPC guide. Anatomy and medical terminology. Now, when you see stuff in here, make sure you highlight it. It will feel like something that's going to be on your exam. The skin is the largest organ system of the body. On your exam, what is the largest organ system of the body? A, B, C, D. You highlight that because that sounds like something that's going to be on your test. Mostly what you see in this book, you're going to be like, oh, I need to remember that. Oh, I need to retain that. You probably do. Highlight it or put it on your index card. Okay. What you're going to do is just take chapter by chapter. So you see how we're doing integumentary system, right? So when we do the step-by-step, we go through step-by-step. I'm talking about the step-by-step book, and then you do your CPT book. So if you have your CPT book, okay, you're gonna go to the integumentary system. That's the 10,000 series. So we've kind of went through that already, but it's to get you used to your book. So we do the step-by-step book review, integumentary system. CPT review, integumentary system. You are to do the same thing. Same thing. Now we are in the CPC guide. In the CPC guide, you should be ready to do the cases in the back. Okay, so what I'm going to do is we're just going to shoot through. I know you guys have already done it, but this illustration that's on the front page, I'm on page 87. I want you guys to make sure that you retain that because this looks like something that's going to be on your test. You won't see a picture, an illustration like this of the skin on your test, but they will probably ask you in what order is the layers of the skin. So epidermis, dermis, and subcutaneous. Same thing as what is the largest organ of the body system? Skin. Put that on your index cards. You can also highlight in this book. Only thing I don't want you to do in this book is write your answers in this book. Use the answer sheet. Okay, use the answer sheet. I put the link in there. I did put the link in there on the last chat. You guys look at the last chat for that answer sheet. And I want you to use the answer sheet because I don't want you to write in your book when you get ready to do those cases. Okay, so in every single chapter of your book, there's going to be a review the same way. One is going to show you some medical terminology at the beginning of your book. Okay, so hopefully you guys got your CPT guide. Okay, ICD-10-CM. It's going to just give you some of the chapters that will relate to the integumentary system. If you didn't get a chance to go over that section with us, go over those chats. Okay, go over the ICD-10 chats. I think this one, you guys remember I told you that this book was going to be I didn't even open it yet. It's been just laying around. I don't even really need it, but I did get it because there's some stuff in here that I do want to show you. But you see, look how heavy it is. This is why I don't get the hard copies no more. Okay, they're all three sitting here and I haven't opened them, but I am going to use them for the classes because I see that you guys do learn better looking at the same material. This is the material that I need you to get. Okay, my books are generally ebooks, but we're going to start working in the hard copy book, and all the books have paper on them. I don't know what's up with that. Okay, so you should be again in your CPT book. Okay, we already went over some of the place of services, right? That's just, something for you to go over. But last time we did class, I told y'all to kind of go through the CPT book, go look for some medical terminology in the back of the book, go to whatever code they send you to. And that's you just kind of getting used to your book, okay? So you can see how you're going to use your CPT book with your CPC guide. Your CPC guide is your go-to. If you can get at least 2024 and up, that's fine. But if you can't, it's okay. I will always have the new book. So if there's something in here that's changed, I'm going to let you know. Normally, they just change the cover or the color or whatever. And, if there's a code change, I'll let you know. The gist of it is to make sure that you have the proper insight of the CPC guide, because this book is what's going to be on your test. This is your go-to. This is where we are. So I don't have my that back screen no more. I can show y'all what I'm looking at. This is where we should be at. Okay. So we've already done your step-by-step integumentary system. You've already went over CPT integumentary system. Now you are in the CPC guide integumentary system. So by now you guys should be used to that medical terminology language, because we've already done that. Okay. If some of you are new to my class and you didn't get a chance to get that medical terminology in, this has tests. This has quiz in it. You can go to Amazon and get this, or you can go to my website and get this, sapphirephysiciancoding.com. I know I always put it on the side, I just haven't had a chance. Okay. I made this book with tests so that you too will be able to test yourself. Okay. There's answers in this book as well. This is going to help you with medical terminology. Make sure you get this book. Okay. You could get it from Amazon, or you can go to my website. Okay. And don't forget, if you know somebody who wants to do coding, they're not sure how to do coding, y'all know I pop this out all the time. Bam. Now, I do have another medical terminology book. I don't know where they are. I have to find all this stuff. Okay. But you just reminded me, I have to order another batch of these. Hold on. Okay, hold on. No, I don't have Twitch on. When I do OBS, I have Twitch on. 5. What did I say? Those cards, the thank you cards, right? Yeah, I think tomorrow will be okay. Okay, so again, introduction is in the front of your CPC guide. Okay, that's what we are in. Okay, I want you to highlight the skin is the largest organ system of the body. Okay, I don't need to put this up because you guys are supposed to have this book. Okay, I gave y'all plenty of time. Now, if you got the step-by-step book, all of that is already in. You can get that. The CPC guide is not down there. Okay, you guys are going to have to get that. So It is made up of two primary layers. CPC question. What are the two primary layers that the integumentary system is made up of? A, B, C, and D. Your answer is right here. Okay. Make sure that you are clear on how this book is deciphered. And your CPC guide. Okay, that's where we're at. Everybody's CPC guide. When you're reading the CPC guide, put yourself in a state of mind where what you are reading is the answers to the question. What you are reading is the answers to the question. The answer is, what is the largest organ system of the body? Okay? Did I say answer? That was the question. The answer, the skin. Okay? So get your highlighters. Y'all already know. I don't know where mine is. Get your highlighters. Okay, and make sure you highlight in your book that first part. The largest organ system of the body is the skin. We're gonna get to the smallest one because both of them you're gonna see on that test. Okay. Now, as you scroll, I'm not going to read the whole thing. I'm just kind of put you in the right place. So, as you start scrolling down, and you're kind of looking at the skin and the dermis and the epidermis, the keratin and epidermis and stuff like that. Yeah, you're going to see some of that stuff on the test. So that's why it's crucial for you to keep this with you when you are studying. Okay. When you get your those of you who don't have your CPC guide, it's fine. You have plenty of time to get it. I'm going to be in integumentary system for a little more than a minute. Okay. The beginning was just, the guidelines, just to see where we're on. Make sure you have your CPT book. So as we come down, we just kind of going, what we're doing now is going over the format of the CPC guide. You're going to hit ICD-10-CM. Okay. Diagnostic codes for the skin are found primarily in 3 chapters in the ICD-10 code book. Chapter 2, go there. Chapter 2, go to chapter 2 so you can see. Okay. Chapter 12. So some of y'all might know what I'm talking about. I wouldn't have this book open, right? So you guys remember when we went over, you know what? The next time I do class, I'm going to have another desk right here because y'all know I'm annoyed already. So in here, this is your ICD-10. Okay, this is what y'all should have. Okay. If y'all don't have your ICD-10 book yet, okay, go to Amazon. No, we don't sponsor anybody, but my books are also on Amazon. Go to Amazon. I think this one is on sale for $79 or something. When Amazon blow them sales and they done, it's going back to $140. Okay, so I want y'all to go to chapter 2, the neoplasm. I'm giving you what is relating to the skin. So go to your ICD-9 book. I want you to take a look at chapter 2, neoplasms. Chapter 12, diseases of the skin and subcutaneous tissue. Chapter 19, injury, poisoning, and certain other consequences of external causes. Okay, go through that. Write it down. Write it down. You might not get a chance to get through it through the class, but I want you to go through that because you're going to see. Let me get this thing open. You're going to see how those chapters relate to the skin. Okay, I'm trying not to break it open. Okay. You're going to see how those chapters relate to the skin. So I want y'all to go. I'm trying not to tear this open. I want y'all to go to those chapters. You're not going to do anything with them. I just want you to kind of start getting used to your book. The same way how we get used to the CPC guide, you guys are going to get used to that. But I want to keep that plastic. That's why. Okay. So just go to those chapters and it's pretty much going to let you know what you're going to be getting into. So 2 is neoplasm. 12 is disease of the skin, subcutaneous tissue, and 19 is injury and poisoning. Y'all know 19 is injury and poisoning because we went over that. Okay. And again, if you don't have your book, you have time to get it because we are still in the integumentary system. So highlight the first part. I want that highlighted. The skin is the largest organ system in the body. Highlight that. Okay. And I'm pretty sure there's something else in here that I want. Oh, right here. So if you got your book, there are 4 to 5 layers of the skin. Highlight that. Okay. Just stratum corneum, stratum luteum. Okay. Stratum granulosa. Y'all know I can't pronounce it. Okay, stratum spinosum, stratum basal. Basal is going to be on your chest. I remember seeing that a few times with my girls when I used to proctor. Okay, I don't proctor anymore, but I remember a lot of stuff that was on the test. Okay, so highlight that. Okay, so where I saw that was on page 88 on anatomy medical terminology. Highlight that. Okay, the dermis is under the epidermis and is made up of two layers. We know that. Okay, but I still want you to underline that because next thing you know, something like that is going to be on your test. Okay. So ICD-10 coding, that's where we're at. I want you guys to go ahead and highlight that. But I'm trying to give you the insight on how AAPC derives from their questions. Okay. They're all in this book. Okay. They want to make sure that you can read this book. Okay. So diagnostic codes for the breast are typically found in chapter 14. Okay. Diseases of the genitourinary system. Okay. Category N60 and 65. You can go there if you want to. If you want to take a look at that, if you have your ICD-10 book, you can go to N60 to N65 just to kind of look at the neoplasm that's going to relate to the skin. Okay, they're going to have breast tissue in there, so that's what they're looking for. Their diagnostic codes. This is just connecting everything to your integumentary system. Okay, so neoplasm table. That's pretty much what they want you to go look at too. Okay, in the neoplasm table, go there so you can make sure you understand what in situ mean. Okay, we did that in medical terminology in situ. We can't go through a full class on YouTube, but make sure you know what that means. Okay, IN space SITU. Okay, primary malignancy, the original location of cancer. Go to C44309. Every time you come across a code in the CPC, y'all know, even when we do step by step, we come across a code, go look for it because it's getting you used to going through your CPT book. So when you like now, I want y'all to go to C44.309. Go to your ICD-10 and go to that. It's getting you used to your codes in your book. No, the book is this big. You're not going to remember the book, but it's still getting you used to flipping through what you need to flip through, especially if you guys don't have those tabs yet. So my old book had the tabs. Look at the chapter that has the tabs on it. That's going to keep you from spending 3 minutes on a question. Okay, and 2 minutes flipping through your book. Put your tab on there and boom, you're going to get to where you need to. So we're in the integumentary system. Highlight what we did up at the top. We just went over IC10, chapter 2, 12, 19. Chapter 2, neoplasm. Chapter 12, disease of the skin and subcutaneous. Chapter 19, injury and poisoning. That's the CPC guide. Go to that. Okay, we're still kind of reading down. So we're on the neoplasm. The table of neoplasms is broken down into 6 columns. If you have a question like this on your test, it's already in there. And this is what the CPC guide is telling you. It's already in there. So if you go there, you won't have a problem finding what? The 6 columns of the neoplasm system, right? They're already in there. The first 3 indicate malignancies classified as primary, secondary, and in situ. This is in your CPC guide on page 88. Okay. This is awesome right here. I know this is a lot for y'all to do, but when y'all see these codes, this is open. When you come across those codes that's up there in the neoplasm system, go look for them. Okay. I didn't get over there yet, but I just spotted them. Okay, uncertain behavior, a specific pathologic diagnosis. This is a lesion whose behavior cannot be predicted. Okay, unspecified behavior. There is no pathological report indicating the nature of the lesion. Okay, we don't know what the lesion is doing. We don't know the activity of the lesion. That's what they're saying to you. Okay, and the code that they have in here, they're using skin, nose, and eyebrow D49.2. Okay, you could highlight that so you can go to your ICD-10 and look for that code. Okay, when you go to your ICD-10, it's the same thing. It's like a dictionary. It's alphabetic order. So if you go in there and you looking for nose or something like that, XYZ, you can find it like that. You're not gonna go to find the D49. You'll be a minute trying to find that. You have to find this part of the body, okay? But I still want you to go in there so you could see how the book is formatted, how the ICD-10 is formatted. Okay, we can snatch that down for a minute. So y'all should have your ICD-10, but I'm just going to kind of open this right here. All right. So if we go to the back, we can go straight to the D. Okay. So when you guys, if you have your CPC guide, go to that same page. Okay. You're still gonna have to go to your tabulars. You can go back there and go look for it back there. So it's just like a alphabetic book still. If your book is not tabbed, then you're gonna have to look for it. Okay, you're gonna have to look for it. So let me get there. So like I said, it's just like alphabetical order. So if you, what color is it? It's like it might be the pink color right here. I know y'all can't see this, but y'all have y'all book, okay? So D, right? I'm in chapter 3, diseases of blood forming. Okay, that ain't it, but that's the chapter that we headed for. Okay, what's the code I told y'all to look for? D49.2. Okay, D49.2. We was already in neoplasm. We're in neoplasm because we're talking about the skin. We're talking about the skin. So we came across D49.2. Go look for it. Go in the back. Go to your tab. Okay. And tell me what it is. Okay. Tell me what y'all found back there. All right. So mine is in the green section. Everybody should have, if you have AMA ICD-10, that's fine. You might have a different color than us. Okay. But it's the same thing. Okay. It is the same thing. So this is getting you used to looking for codes. When you take your tests, right? It's going to be a lot easier for you when you get used to looking at these codes. We've already done the ICD-10, so that means we've already looked over this. We've already went over this. But if you haven't went over this, go to your tab in the back. I call it tab. We talk about tabular list, okay? Go to certain infectious and parasitic diseases. Okay, we can go there and you can kind of read that. But whenever you come across a code, when you're reading, go look for it. Okay, it's not that you're going to stop and get thrown off. You're going to start getting used to this book. You're going to start getting used to your ICD-10 book. Okay, so neoplasm of unexpected behavior. Okay, of bone, soft tissue, and skin. The reason why we looked that up is because it's in your CPC guide. Okay, whatever you see in your CPC guide, okay, that's your certified professional coder guide from AAPC. That's what we're looking at. Look it up. Okay, it will get you used to the codes that you may see on your exam. Okay, so let's move over to the next page. We are still in integumentary system. We're referring to the skin. Why, Ms. Lambert? Because it is considered integumentary system. Skin cancer is what we are looking for, and other skin irritants that are neoplasmous as far as cancer forming. So, I'm on page 89, chapter 5, y'all. So, you're still going to look up the codes that you see. It's not, this class is only an hour, so you can't do it like with me like that real quick. But you can do it when your class is over. C4490. What I'm gonna do, Ms. Lambert, you're in your ICD-10. You're going to your tabular list. Okay, your tabular list is where you're going to find your code. Okay, that's where you're going to find your code. The codes that I'm just telling you to look for, only to get you used to your book. Okay, the ICD-10 is just big. I know years ago it was nowhere near as big as it is now because we have more codes in there. We have more diseases in there. Okay, so skin, when you go to neoplasm, right? When you go to neoplasm system, go to C4490. You're going to see it anyway, because that would be with, I'm just giving you an example. C4490 primary, secondary, primary, and your secondary. So your primary disease is C44.90. Your secondary is C792. In situ D049. In situ, if you have a cancer and it metastasizes, y'all ever hear that word metastasize? I know it's a doozy. Okay, good. Look it up. Okay, we showed y'all that in the first session. Go back to your ICD-10 class. Okay, when the cancer is in situ, it's not spreading. It's growing in that same spot. It can grow down into your skin underneath your subcutaneous, down in situ. Okay, so I want you guys to look up those two words: metastasize and in situ. Okay, benign we did benign, but you guys can look at it. Okay, uncertain behavior, unspecified behavior. So you're going to go to C4490. We're talking about the skin. We're still in the skin. Okay, primary. Okay, primary disease. C792, secondary disease. D04.9, in situ, the cancer that is growing in situ. Okay, D23.9, benign. This cancer has become benign. Don't forget, I want you to look up metastasize and in situ. Okay, so benign, we're looking up D23.9, uncertain behavior D485. Go to your tabular list and run that across, okay? And we're doing it for the skin, just so that you can get used to looking at your book, okay? Squamous cells, carcinoma C422, okay? Carcinoma skin on the elbow, C44.60, secondary C79.2. Get used to the neoplasm section. Get used to the neoplasm section. You will have questions on your exam. Okay, you're gonna have questions on your exam regarding that. Okay, and again, for your homework, you should have already done this. So I know you guys did already, because we went over this in the last class. But I need to make sure that you're clear on metastasize and in situ. Okay, look it up. Okay. Or go back. Those of you who missed the ICD-10 class, go back to the ICD-10 class, okay? But I want you to go to the tabular list. That's how you're going to look up your codes. Go to your tabular list. If your book is already tabbed, or if you have tabs, I'm going to show y'all that in the next class. I already did the tabs already, but I'm going to show y'all in the next class, okay? But here, this is your tabular list. Okay, when y'all get right here, this is where I want y'all. Okay, this is where you're gonna find your codes. Okay, your digits are going to be here. So when you're looking for those codes I just gave you, that primary code is C4490. Go to your tabular list. When you get here, you're gonna see guidelines. That what I just showed you was guidelines, specific guidelines. Okay, and once you finish reading those guidelines, then you're going to get to your codes. Okay, then you're going to get to your codes. An example of the first code in the first section, A41.5, right? Certain infectious and parasitic diseases, right? Mine is brown. You may have a different book, but that's the color of my tab in the front, okay? We're already up to the C's, but I don't want to get to the C's right now. I want to show you the B's. Okay, B9719. You see how the book is going? And then you get to the C's. Same thing. So when you get ready to look for one of these codes that's in this book, that's how you're going to look for them. Okay, so let's say C3, they have nothing to do with what I was just talking about, but it's still in your C code as a malignant. Okay, C34, malignant neoplasm. Okay, go look for C34. Okay, C34. We're only looking for 3 digits right now because we're not going all the way over, okay? The more digits you add, the more issues the patient has, the more in-depth we are getting, the more descriptions we are giving to the disease that the patient has. You see a patient that only has your 3, okay? It's not a detail, okay? When you get to the 5th digit, then we got some problems. Okay, inflammation conditions of the skin. I know you guys already did that, but it here, when you get to this section, inflammation conditions of the skin, highlight what's in the degree of burns. Okay, I'm on page 91. Okay, and again, we're just going over this, getting you to the coding section. Because tonight I want to see y'all do the coding. Okay, give me the answer. Put the answer right there. If y'all not able to do it in like 5 or 10 minutes, y'all gotta DM me with the answers. Okay. The case that I put up there the other day, I put a test up here for y'all to do. Make sure y'all do that HIM test. Okay. No, y'all don't have the answers to that. Y'all can send it back to me and I will grade it to y'all. All right. I'll grade it for y'all. So we are in the integumentary system. So in this section, I know you've already done it, but I want you to still read it. Okay. Read it again till you get a lot of this in your head. Okay, that's why we're going very slow. Okay, so example, squamous cell carcinoma, right arm. Squamous cell carcinoma sounds like something that's going to be on your test. Make sure you take heed to it. Okay, look up this code, C4462. Okay, C44622. Okay, look up that code, and you see that code has 6 digits, right? So it's going to be invasive, right? We went over ICD-10, so y'all go back to ICD-10 so y'all can figure out what's the first digit, what's the second digit, okay? Once you look over those tests, then y'all pretty much should be up to where we are. I don't have to like explain, like even the 6 digits, I wouldn't have to explain what the 6 digit is. Go back over to chat and then y'all will figure that out, okay? Then y'all come back with us because we're moving along the advanced sessions, okay? So y'all going to do inflammatory conditions of the skin, other diseases of the skin, and subcutaneous tissue. Definitely want y'all to go back over that. If you are not ready to do those cases, don't worry about it. We are still in integumentary because even though you've done this is what your cases are going to be about. So I'm not going to go over the whole thing, but I do want you to look up the same codes in this book before you get to the cases, okay? Before you get to the cases. Okay, stage 1, persistent focal erythema. Don't look that up. I'm just reading down, okay? I do want you to look up L57.0. Look that up. Write that down. Okay. Be sure to review your ICD-10-CM guidelines regarding pressure ulcers. You guys remember how I told you how to go through that ICD-10 book, right? So you have I.C.12.A. Go to ICD-10 guidelines and find that. Because you remember we went over that. Because you might have something like that on your test. They're going to, because they want to see if you've gone through the ICD-10 guidelines. So in your guidelines of your ICD-10 book, go to I.C.12.A. Once you do that, you begin to like the book. You'll begin to know where things are. You guys remember I put that book up there where I tab my book and put that in there? Write that down so you guys can find that, okay? And then come back and tell me what it says. What it says, okay? Because a lot of what's on your CPC exam, you're going to need to know about the guidelines. So your ICD-10 book that I gave you, look below, look at that description below. That ICD-10 book, okay, gives you the guidelines. If you want to use the CMS guidelines on CMS website, you can use it. Put in 2026. It's going to be 2025 and 2026. Okay, but you got to know those guidelines. So go ahead and look that up. Okay. Okay, now we're passing that. Injury and poisoning. Make sure you read the injury and poisoning. Why, Ms. Lambert? Because you're going to have at least 3 questions on injury and poisoning. Okay. At least 3 questions. I know we went over it already. I'm not going to go over it again, but I'm just telling you, it's in chapter 19. Y'all can go to chapter 19 and take a look at it so y'all can see what's in it. When I give you a chapter, just look at it and see. They're saying, chapter 19, take a look at it, okay? Remember I told you your tabular list It's like alphabetic order. It's like A, B, C, D, and then chapter 1, chapter 2, chapter 3. So they're telling you that injury and poisoning is in 19. So go to your ICD-10 and go to chapter 19, and then you'll see that the injury and poisoning is at the end. When they say injury and poisoning, it's like you fell, or there was a fire, or the person got hurt in a fight, or the person got burned or something like that. It wasn't a surgical type of thing that needs to happen where they need to get an operation, or he's coming in, he's having an operation. No, injury and poisoning is he fell. Just like that thing that happened today on Twitter when a young man had a autopsy on his son, and they found out that the baby was poisoned. They thought the baby was injured. The baby was poisoned. I know. I can't even talk about it. It's like so unreal. I can't even believe it, because you can't believe half the stuff on Twitter anyway. But, that was a scenario. So in your ICD-10 book, go to 19, okay? And I'm just sending you to 19 so you can look at the injury and poison and see what's in there. And pretty much you're going to see the same thing as far as a guideline in there as well, okay? So in your practice, you're going to have that at the end. So don't worry about that. We're just focusing on the cases that we're getting ready to do. Okay. Read the degree of burns. Okay. Normal, healthy skin. This is where we are. I don't know if you guys are on the same page, but this is where you guys should be. Your page should look like that. Okay. Should you remember what burns is what, Miss Lambert? Yeah. Okay. First degree burn injury. Second degree burn injury. Third degree burn injury. Okay. You could see right off the back, this goes from not too bad to worse. Okay. So there will be something on your chest. If you get injury and poisoning section, everybody's not going to get the same test. You're going to get a different test. Whether you get it or not, I still want you to put this on an index card. Okay. Put this on an index card, because that's how you're going to retain. Okay. So burns are coded based on several factors. Location. A separate code is reported for each burn site. Degree of the burn, first degree, second degree, third degree. Okay, that's the degrees of the burn. Okay, total body surface area is TBSA. Okay, TBSA. Okay, the total body surface area affected by the burn, a code from category T31 is used with, y'all can go to that. Go to T31 so you can just see, is used when the site is not specified to record the burn mortality, or when there is mention of a third degree burn involving 20% or more of the body surface. The rule of nines assign percentages to each body area to assist you in decoding the TBSA, total body surface area. Now, the rule of nines is a certain part of the body that was burned. Okay, that's what the rule of nines is. In Sapphire Academy, you guys already went over this. But those of you who are in YouTube, this is the rule of nines. Okay, and this lets you know how you're going to code a burn. Head, 9% of the body. Trunk and back is 18% of the body. And we're talking about where the person was burned at. This is what you're going to be coding. When you find the code is going to tell you what part of the rule of nines was indicated in the report. So in the provider's report, the rule of nines may have been the trunk back 18%. Okay, a whole right leg 18%. If it is a child, the head and neck will be 18%. The trunk front will be 18%. A whole leg on a child will be 14%. Okay, so if you are coding a burn, you need to know the size of the burn, where the burn is located. So when you start talking about the rule of nines, that's what they're talking about. Okay, that's what they're talking about. I know we got like 15 minutes. The time went so fast. Okay, so we just went over most of the basics, but you're going to go over disorders of the breast. Okay, and then after you go over disorders of the breast, I want you to look up N62. N64 and N65. Okay, so we just kind of went over the rule of nines. Make sure you go over that. That sounds like something that's definitely going to be on your test. Or they may say, what is the rule of nines? A percentage of the body that is burned. That's what it's going to show you. Remember, if it's a child, the percentage of the body of a child is going to be less. Okay, a whole leg for a child is 14%, whole leg. Adult is 18. Okay, CPT codes found in integumentary system section include procedures performed on the skin and the nails, as well as those performed on the breast. So yes, they're still going to give you some CPT in your CPC guide. The CPC guide will give you, it's set up the same way throughout. It will give you some medical terminology, it will give you some ICD-10, and then it will give you CPT, okay, of what they're going to be looking for. Okay, so incision and drainage, debridement, paring and cutting, biopsy, removal of skin tags, shaving or epidural dermal lesions, removal of lesions by extension. Okay, so I'm not going to go over that whole thing. You are going to go over that, especially flaps and skin. Okay, you're going to have a fickle with the flaps and skin. So make sure you go over that. And remember, if you have a problem kind of deciphering some of the ICD-10, look at, I would go to YouTube and just type in what I want to find. Okay, go to YouTube and type in what you want to find, whatever you want to kind of look for. Okay, I know I see my hair sticking out all up over there. I can see it in different angles. All right, so destruction. Make sure you got, I always tell you about the Mohs micrographic surgery, pressure ulcers, the cubitus ulcer, burns, local treatment, and the breast. Okay, that might be the hardest that you do. I think integumentary and musculoskeletal might be your hardest as far as this surgical section. Okay, ain't got nothing to do with pathology and radiology. Okay, I'm just talking about the surgical section. Okay, so your chapter review, melanocytes exist in which layer of the skin? Okay, you can see that in your book, and we just talked about that. The same way how you see this book, your CPC questions will be this exactly the same way. Which of the following best describes psoriasis? A, B, C, D. A 4-year-old present with an upper arm abscess in the subcutaneous tissue. An incision and drainage technique is performed. I can't say that word, but blank expressed and dry gauze dress is applied to the procedure code. I have some of these words in here I can't say. Okay, so it's either going to be A, B, C, or D. Your code would be 160, 161, 239.30, or 101.80. Okay, so that first case is a very small case that you should be able to do. These little cases like that, I don't expect you to spend the whole 2 minutes. Little tiny cases like this, no, I don't even expect you to spend 30 seconds on it. Read it, get the answer, and move on. Okay, so those are kind of questions I want you to do to move on with. Don't spend too much time with them, because I want you to use your time for your big cases. Okay, the Mohs surgery, that's the one I want y'all to send back to me. Okay, Mohs surgery is to be performed on a 56-year-old with basal cell carcinoma. Okay, basal cell carcinoma on the neck. Okay, if you've never seen that before, like I said, go to YouTube and type it in. The gross tumor is completely excised, or you can go in and you can ask for the surgery. Ask YouTube to give you the surgery. Okay, so this case I want you to do, and then you give that back to me. Okay, and you guys can send me back the case on this in a DM. Okay, you can also check yourself. The CPC guide, the answers are in the back of the book. When you do check yourself, don't forget to read the rationale in the back of the CPC guide. Okay, so these longer cases are the ones that I want you to spend more time with. So number 6 is a short one. Number 7 is a long one. A 3-year-old pulls a pot of hot water. So this is a burn one. I know. This is a burn one, but you guys have to do this one. And then it kills me when I don't know why they use children and babies in here. I wish they would have just kind of strictly put it to adults. I mean, what's the, I don't remember any, small, children being in any cases of CPC, but you might get one. So number 7 is about a 3-year-old child who had a pot of water fall on her. Okay, so I still want you to code that. It's multiple choice. Pick the one you're going to choose. Okay, so number 8, this patient's going to have a biopsy Okay, and this is going to be easy. In this case, I'm on number 7, y'all. Okay, all right. There's no operative note there. They're not giving you an operative note, but they are giving you one on number 9. This one is patient presence of operative suite with a biopsy proven squamous cell carcinoma of the left ankle. A decision was made to remove the lesion and apply thickness skin on the site. Before you code that, read it 2 or 3 times, because if you go to code this case and you're not clear on the surgery that was just done, you're not clear on the procedure that was just done, you're not going to get the right code. I'm not saying you're going to remember every procedure there is. Just put yourself in a state of mind with the surgeon and what he's doing. If you can't put yourself in a state of mind, go to YouTube and type in the surgery. Okay, just type in whatever the procedure is. Okay, number 9 is a good one. Number 9 is operative note number 1. Procedures performed, preoperative diagnosis, postoperative diagnosis. That's a true test question. I'm on number 9. So when you guys get to number 9, okay, send me back the answer for number 9. Yeah, we know the answers is in the back of the book, but it doesn't matter if the answers are in the back of the book. I still want you to try it on your own, okay? Even if the answers are in the back of the book, you still have to read the rationale. Okay, let me show you what I'm talking about. Those of you who don't have your book yet, when you get your book, right, and you do the cases, because you guys got 10. Well, 1, 2, 3, 4, 5. You got 7 cases to do in there. Okay, that's homework. That's the cases. I know y'all can't do them now. We only have like 10 minutes left, but the rationale. Let me get to the rationale for that. When you go to the back of the book and you check it, remember, don't put no answers in the back of the book. Okay, I want you to use the answer sheet that I gave you. Okay, use the answer sheet. I don't know why I have this in here. Okay, so is that 1? That's 1 in chapter 1. Okay, let's. I ain't gonna give you the answer. Let me just look at 8 real quick. I'm trying to look at one where I can show y'all what the rationale is. Okay, here. So y'all know what the rationale is. I'm just kind of showing y'all when you. Let me see. Is there one over here? Right here. So you guys see the answers, right? You see the answers, and then you see that says rationale. The rationale will tell you why the answer is what it is. If you've chosen an answer and then you go in the book and check it and it's not right, make sure you read the rationale. Right or wrong, read the rationale. Okay. Number 5, on chapter 2, the rationale is very long, but the rationale is going to tell you the answer. It's going to tell you why the answer is what it is. Maybe you may not agree with it. Maybe you say, oh, I thought C was the answer, or I thought D was the answer. Once you check it in the back, the rationale will tell you why it's that answer. Okay. So right now we're on the cases in chapter 1. And the cases are pretty long. But like I said, when you go to the back and you check, I'm talking to YouTube. When you go to the back and you check, make sure you read the rationale, okay? Because the rationale will help you to code. Once you get through all of these sections, all of your sections that are in your CPT, then you will be most comfortable with the book. So when you do get ready to find your codes, it's most comforting to see you just kind of breeze through the book. You put in your tabs on and you breeze through the book. I'll have some tomorrow. When is your next class? Friday, set tomorrow. Okay, so I'll have some tomorrow. I'm gonna show y'all what those tabs are. You know, I showed y'all before. I must have gave some away, but I had a ton of them up here. I don't see anymore. Okay, so those of you who just walked in, we're on chapter 5. We're in the CPC guide. So and I got 4 minutes left. So in your CPC guide, right? We're on chapter 5. Your homework is to finish those cases. Finish those cases that we started. Okay, I want you to go to the back and test yourself. Okay, so you guys have already done ICD-10. You guys already we did the business of medicine with billing. We've already did medical terminology. We've already did the CPT and ICD-10 and some of the HCPCS. So you should be able to code some of the cases. Go to go to your CPC and go to Integumentary system, and you can kind of look in there and get a heads up on what those codes look like. Remember, y'all was supposed to go through the CPT and highlight some of the codes that kind of look alike. So we've already done CPT. Your last of the Mohicans is CPC guide. So when we move to musculoskeletal system, we will start in step by step. Then we will do CPT. And then we do the guideline. Okay. So CPC guidelines. So again, just do those codings. Let me see. Do the codes that I'm asking you. Get used to integumentary system area. I mean, some of you might do good. And again, when you take your CPC, I mean, it's not imperative that you get, a 90 in each section. If you get a 90 in one section and a 60 in another section, you still can pass. You know what I'm saying? It just means you didn't do good in one section because they're going to average them out. So if you've got a 90, 80, and bam, a 60, I don't think it's going to killjoy you from passing your exam. Okay. But integumentary system and musculoskeletal system, you guys have to work hard on, because you must be able to find those codes and you have to decipher those surgeries. In the skin surgeries, like some of the tag removals, you're going to need to know the size of the tags. And that's why you have to bring your calculator when you're going to take your test, because you're going to have to do a little bit of calculating. When you go take your test, you're going to have your calculator. You're going to have several pencils. You're going to have scrap paper so that you can write things on, okay? So, don't get nervous when it's that time for you to do what you need to do. So in this book, in the ICD-10, we've already done those chapters ahead. 1, 2, 3, and 4. The business of medicine goes with medical billing. So we more than likely did that with that. But those of you, I know it's already 8 o'clock. I don't know how an hour went by so fast. Those of you who are new to my class, go over the chats that we already did so we can get you up to this point. Okay. I did, like I said, I did find a way to send you documents. Okay. If you need to go over your ICD-10 in here, that's fine. We're in the CPC guide right now. We're still here. Tomorrow we will still be in this section, but we are doing the cases, so you guys should be up to those cases. Okay. Like I said, number 9, the operative report is there. 10, you have an operative report there. The diagnosis is listed. Okay. So find that diagnosis. Okay. Make sure you have your book. Okay. Procedure 2, excision cyst left upper back. Okay. Procedure 1, excision cyst midline upper back. Okay. Preoperative note. The doctor is going to give you an indication of what he did. Okay. The patient has an excision of a painful cyst on midline upper back. Midline is, you see that where you have that dent, like if you're sitting down and you put your hand in the back of your back and you see how you have like a dent in the back of your back, right there below, that's your midline, just above your buttocks right there. Okay. The lesion, I know it's just like y'all in front of me. If you type it in YouTube, they'll show you where it is. That's only one of the biggest differences from being in the classroom and being online. If I was standing up at my podium, I would literally turn around and show y'all where the midline of the back is. At some point, I'm going to start using my podium again. I know we used to use the podium. I don't know, like I haven't used this since last year or so, but I think since I got the books, we can start using the podium again. The reason for me using the podium, look at the books. I can't even hold them. I got books all over the place here. When I had the podium, when we use that, I put the books there and then I still can come at my desk. So I don't know. Tomorrow we might have the podium. Okay. So let's get back to the case. So the case, as in indications, is the process and what happened in the surgery. Okay. The lesion has previously ruptured and has significant scarring. Okay. The patient also has a painful cyst on the left upper back. the patient is allergic to penicillin and takes aspirin and Mecardis for blood pressure. Okay, there's a lot going on with this patient. I can tell you right now, there's a lot going on. And her case is very long. And these are the cases that you need to spend time on. There's a case about that big. Okay. So, this is what, I want you to spend time on. The smaller ones, the cases that are like this, they open and close cases. Y'all can finish with them real quick. But the longer ones, you have to decipher what you're doing. The preoperative measurement of the lesion was 1.1 centimeter. The proposed excision lines were drawn. They're drawing where they're going to cut. When you see the TV and you see these things going on TV, they show you like with the black marker where they're going to cut. That's what they're talking about. Anesthesia was delivered locally with 5.0 cc of 1% isocaine with ephedrine buffer. That ain't got nothing to do with it. So don't let none of that stuff throw you off. Don't let the anesthesia and the la and the so and so. Don't let none of that throw you off. Okay. In your operative report, give the code that you think it is. Okay. Give the code that you think it is. Don't worry about being off. Just give the code and don't erase it. Let me see what you said. Okay. In the back, they're just showing you what the pathology was, what the specimens was, what are CPT and ICD codes. So just asking you that. Okay. So in this section where you have these bigger cases, okay, they are not giving you multiple choice. They want you to tell what the procedure is. So when you're doing cases, because I can see when you guys start reading them, it's going to be a lot of stuff, a lot of description in the cases. Focus on what the procedure was. Focus on what the procedure is. The lidocaine and the anesthesia, those are not procedures. Okay. Focus on what the physician did to the patient. The patient was instructed to return in 9 days for suture removal. That's not what we want to code. We want to code what the procedure was. So when you do see these cases and you see the site was cleansed with betadine, it's just describing to you. Okay, I don't need you to code it. I want you to code what the provider did. Okay, so that's going to be your giveaway on how you're going to code. Okay, because in some of these descriptions, you're going to see a whole lot of initializing inside this note, and he has to be detailed in his note. Okay, and he's just kind of gearing up to what he did after he did the surgery, what he did during the surgery. You see what I'm saying? So that's what I want you to focus on. 9, 10, 9 and 10 is both long. Okay, 9, 10, 8. Was that the patient with the squamous cell? Yeah, 8 is the patient with the squamous cell. You got multiple choice on that. So those cases are the cases that you need to do. I can't read the cases out on the YouTube, but I want you to go ahead and do the cases. Okay. First thing you're gonna do, if you're still not familiar with your ICD-10 book in the integumentary section, go to the integumentary section. Look at what's in there. You remember what I told you when we first started with the ICD-10 classes? We first started with CPT classes. Go to your CPT book in the integumentary system. Head for page by page. Read your guidelines. Look at those integumentary codes. Get yourself used to those codes. Okay? A 4-year-old person with an upper arm abscess. I know I can't read the whole thing, but you can do it for homework. Okay? The answers again are at the back of your book. Okay. I mean, you're going to test yourself for real. I mean, you guys are at home. You're going to test yourself on a real level. If you don't feel like you are familiar enough with medical terminology, go back to the medical terminology class. Okay, and go back over some of those things there. So you're going to do 2 things. I know it's 6 after. I don't have a class. I'm done. I'm finished. Your CPT book, go through integumentary system. Okay. Your ICD-10, I want you to just go through your ICD-10 that's going to relate with integumentary system. Remember, we just talked about that. So I want you to do in your ICD-10 book, right? You're going to chapter 2, neoplasm. Chapter 12, diseases of the skin and subcutaneous tissue. That's in your ICD-10 book. Okay, that's in your ICD-10 book. And then I want you to go to chapter 19, injury, poisoning, and certain consequences of external causes. Okay, go there so that you can get used to the integumentary section. You start getting used to where you're going to find codes as it relates to the skin. Okay, and they're telling it to you right here. And remember, your CPC guide is arranged in the same order. You're going to have medical terminology. They're going to tell you where your ICD-10 codes are, and they're going to give you a description of the section that you're reading. Okay, integumentary system. I want you to take note of first degree burn, second degree burn, third degree burn. Okay, the pictures are here. The pictures of the illustrations that I was telling you guys about, right? And the stage also, stage 1, 2, 3, and 4. Read about the ulcers. Some of you might have worked in nursing home before, and you've seen patients with ulcers, like literally holes in their body. This is going to give you a little bit more insight on ulcers. Okay, and those chapters that I gave you are going to put you in the right place to kind of get you familiar with the codes that you're going to use with that. Okay, backtrack. Location. A separate code is reported for each burn site. We talked about the burn sites. Okay, 1, 2, and 3. Normal skin, first degree burn, second degree burn, third degree burn. Okay, we talked about the rule of nines. Okay, total body surface area, TBSA. Put that on an index card. Okay, you don't have to remember the rule of nines. There is a rule of nines inside your ICD-10. I have to see if there's one in CPT. I don't remember or not. But if you get a question on that and you don't remember 18%, perineum 1%, you can write a little note on one of your little note pages in your book if you have a question on this. Okay, that says what percentage of the head and neck were burned. What is head and neck percentage considered? So the percent of the head and neck is considered 9%. So make sure you study those rule of nines. Okay, they may be, like I said, when you go in front of your book of your illustrations, you might be okay with looking for them. But if you don't see the rule of nines there, put the rule of nines on one of these little note pages that's in your ICD-10. Okay, so we went over disorder of the breast. We went over some of the codes that you need to use. Go take a look at them. In 60, inflammation disorders of the breast. In 61, hypertrophy of the breast. In 62, unspecified lump in the breast. In 63, disorder of the breast. In 64. Okay, and deformity and disappropriation and reconstruction of the breast in 65. Go look for those, and it's going to get you used to going through that section. Okay, incision and draining, IND. If you get something on the chest that says what is IND, incision and draining. Now, as long as it is in that area, if you're in a whole different area, okay, and you see IND, it's not going to be incision and draining. They may be talking about something else. If you are in an integumentary system, in that section on your CPC, and they say, what is IND? You know that it's incision and draining. Why, Miss Lambert? Because it's an integumentary system section. Okay, so that's just a word from the wise. So don't get stuck on your CPC. Just like MAC, right? And what's the other one? Medicare administrative contractor, and the other one is monitored anesthesia care. Don't get stuck with that. Monitored anesthesia care, Medicare administrative contractor are both MAC. If you're not in a section that's talking about Medicare, then you know it's not going to be Medicare administrative contractor. Okay, if you're in the anesthesia section and they say, what is MAC? And they ask you that in that section in the test, you know it's monitored anesthesia care. Okay, so don't get duped on that one. All right. So just back, we already finished. We went over debridement, removal of skin tags, paring and cutting. Okay. Nails introduction. You guys are reading this pilloidal cyst. There's going to be something on there on pilloidal cyst. It's a sac under the skin at the base of the spine. Make sure you read that one. You may get something on that. You know where at the back of your back, right? It feels like it's like a bone. It's like your backbone. I don't know what they call it. It's like a tailbone. Pilloidal cyst. That's where you can get a pilloidal cyst at. That's like your tailbone in the back. That's what they're talking about. Pilloidal cyst is like down, like under, like that. I know I'm acting like I'm in a classroom. All right, certain stuff I can't say on YouTube, but put it on YouTube so y'all can see where it is. But this is it. I mean, this is where we get to the gusto. But y'all need to join the Sapphire Academy, all right, to get into more of the subject, because most of what's in the Sapphire Academy, y'all going to get a little bit more, okay? You get much more if you're in the Sapphire Academy. You have material that you can take home. You get free books that you can take home, okay, that you can take home. I mean, that y'all can download, okay? So this is how we have to do this on YouTube, because I can't give you 100%, but I can give you at least 60. Okay, and you guys can be put in the right place. I know it's already now 12. Sometimes I go to 2 hours, but I'm not going to 2 hours. I'm telling you right now. So Mohs micrographic surgery. Make sure you get that. Okay, read that section in your CPC guide. Breast, burns, local treatment, pressure ulcers, and decrepitous ulcers. Okay. All it takes is practice. All it takes is practice. You have to read this CPC guide at least 3 times. When you guys do your homework, you've only got 10 questions. The first 1, 2, 3, we did 2 cases already. Okay, we did the 2 cases already. The first one, 9, we went over, and we also went over 10. Okay. I can't read the whole thing, but you guys have to read it, okay? And then get your answer. Check it at the back of your book, and then read your rationale, okay? You have to read the rationale to it so that you can be clear on it. Next time we have class is going to be tomorrow. I'm going to put the thumbnail up. It might be tomorrow. I'm not going to do one tonight, okay? Okay, that's musculoskeletal system. We are not up to musculoskeletal system yet. When we do get up to musculoskeletal system, it's step-by-step, CPT, okay, and then the CPC guide. We do the ICD-10 within the CPC guide, okay? So all the codes that we kind of looked over in the ICD-10, I want y'all to kind of go over it. But I want y'all to go ahead and look through the ICD-10, okay? Go to the back, go all the way to the back until you get to a tabular list. It's going to say certain infectious and parasitic diseases, A00 to B99. Yeah, read that. Okay. So this class is over. It's 9:15. Be ready tomorrow. Catch Amazon. Catch those books on Amazon. Okay. Catch your books on Amazon. All right. They're still on sale. Okay. So I didn't put anything in the chat tonight, but you guys got all your links below. Okay. I'll see you guys tomorrow. We're out.